All right, guys, let's talk about chest tubes. So what are some indications for chest tubes? Typically, if an individual has air or fluid within the thoracic cavity, we will put in a chest tube to drain that air or fluid. So this could be a pneumothorax, it could be a hemothorax, it could even be when you have pus in your lungs called empyema. Now, other indications can be a person who has surgery in the thoracic cavity. So a client who comes back from a CABG, or somebody who has a thoracotomy where they cut out a piece of the lung. Now, there are two types of chest drains. Let's dive into the components of a dry suction chest drain. Okay, so each chest drain has three components. Let's start off with our collection chamber. So we have this tubing that connects to our patient. So if we have a hemothorax, we're going to be draining blood out of the thoracic cavity. So that blood is going to drain out of the patient and into our chest drain, where we have numbers that we can measure by hour how much drainage is coming out. Next, we have our water seal chamber that helps us understand the pressures within the system. Remember, our thoracic cavity is a negative pressure environment. So when we take in a deep breath and we have a chest tube, that water seal level is going to go up. And then when we expire or exhale that breath, it's going to go down. So normal titling is an expected finding within the water seal chamber. And lastly, we have our suction control chamber. It's important to remember that this is set by a doctor's prescription. Now, you have two types of these chambers. Here we have a suction control chamber where we set the number via a knob. And here we have our water seal chamber, and we will actually pour water into this section up to the number that the doctor has prescribed. Now, it's important to remember that our water seal chamber and our collection chamber are the same here. The only thing that's different is how the suction is set. All right, there you have it. Those are our chest tube systems. Now, follow for more. Tomorrow I'm going to be doing another NCLEX question on chest tubes. See you then.